neck pain. And when we talk about neck pain, we'll talk tonight specifically about a differential of neck pain, so different types of pain. And in doing that, how ranges of motion, we'll just use the word ROM, the letter abbreviation ROM for range of motion. We'll talk about qualities of pain to help us in our differential. And we'll talk about strength and weakness, which precludes often pain. So strength versus weakness. We'll look at referral pain patterns that actually come up into the face, so we'll include some facial pain as our discussion this evening. But again, we'll try to really focus on neck pain, its origination, differential, how we treat, and then some recommendations for how to keep it from occurring. Okay? Any questions thus far? Good enough. Let's go for it. When we look at the neck itself is divided into 7 segments that we call cervical segments. So we use the abbreviation CS as cervical spine. The first vertebrae in the neck is what the skull actually rests on. We'll let her abbreviate that as C1. The second segment actually has a little tooth-like process that comes up and then goes back like this, and that one is C2. The amazing thing about these two segments is if you actually turn them up on end, C1 basically looks like this, and C2 looks like this, and creates then a pivot point for C1 to be able to rotate around that pivot. Okay, so it sets up almost like a thumb, if you will, and then that ring sets and pivots around that segment. It's really fascinating when you look at the biomechanics of the neck, and especially this area. This is also known as the atlas and the axis. Okay? So the atlanto-axial articulation. It's so important though because when we even look, this range of motion is primarily in rotation around the axis. That's why it's called that, of C2. Whereas the primary ability to flex and extend occurs in a gapping between C1 and the occiput that sometimes is abbreviated as C0. Okay? So when we look at this, a lot of times when there's been a trauma or there's been some type of a recurrent overuse injury, heads that are down, people who lay on their beds looking at their books late at night reading or watching television with their head like this, computer people, never dentists, okay, they never sit like this. Those people often will have a loss or an aberrant motion when we look at these motion segments between C0, C1, and C2. Okay? The next segments actually create for us then a natural curve that normally should occur this way between C3, 4, 5, 6, and 7. And we see normally a curve like this, or optimally, as some people in biomechanics will say. The interesting thing is, this is really a secondary curve that's part of brain development. Remember, when the baby is forming in utero, the baby's spine is in essence one curve like this because it's wound up in that fetal position. As the brain begins to develop, baby actually starts to lift its head and look forward and then start to be able to push up. This creates a secondary curve for us in the neck, and then as baby's actually able to start to bear weight and crawl, then what we see is this secondary curve in the spine begin to form as well. Okay? So we have the sacrum, a lumbar curve, and then a cervical curve, with this remaining in the thoracic spine and the sacral segments as primary curves. Kind of fascinating, isn't it? I think it's amazing when we actually look at the development of baby and progression of baby's spine and baby's neurologic factors, how important it is for us to allow these natural curves to begin to form as brain actually begins to form, and how important it is for a baby to reach milestones that, if precluded or prematurely advanced by putting them into a bouncy seat when they're only 3 months old and their heads are falling over, or we have them in a seat that keeps them upright, before they even have the developmental brain capacity to sustain these postures, we actually create for them aberrancies that may occur later on and be manifest from anything from their ability to communicate, to their abilities to comprehend and take in information, to their ability then to move and express. But we're so excited. Yeah, my kid, he didn't even crawl. By 6 months, he was walking. Whoa, we need to back up and let baby actually reach its milestones before we push them into an advance. Okay? So one thing I want you to really take home tonight, those who are parents and grandparents, don't be overzealous in allowing your child to reach milestones that are premature in their developmental stages. Let them crawl for at least 3 months. Before they even crawl, let them spend tummy time and learn to roll so they can actually lift their heads. Most fascinating thing I see is when you look at the ability to do a push-up and push the body away, you actually develop this curve. Okay? And yet, those who go to the gym a lot, a bench press, a lot of people will be laying down and try to look, or they'll do a dumbbell fly with their head inflection. Head inflection actually inhibits the push-up motion. So if you were actually to ideally do an exercise like a push-up motion, you would actually, on your back, take and roll up a small towel, put it behind your neck and keep your head comfortably there, and do a push-up from that position, which mimics this crawl position, and you'd actually see more power. Okay? Very, very fascinating though when we start to look at the outputs of the body based on neurologic development and some of these simple things that are associated with some of the neurologic reflexes that are dependent on movement. Okay? So again, we have a cervical spine that we're going to focus on tonight, a thoracic spine, middle back, lumbar spine down low. These are our secondary curves, and then the sacrum and tailbone are the primary curves that are sustained. Let's come back then and look at this. Between each of our segments, from C2 down now, so let's get this a little bit more closely related. From C2, then between C3, C4, C5, C6, and C7, there's actually a disc. Everyone's heard of intervertebral discs, but so often when we talk about disc, we refer to lumbar spine discs, right? I have a disc bulge, I have pain that radiates down my leg, I'm aware of some type of bulging or protruding or surgical procedure that my friends had to have to correct that disc. In the neck though, these discs are very, very important because they actually function as ball bearings for these bony segments to be able to move over, and so we actually see this type of movement forward and back flexion, flexion extension, and then we also see lateral flexion and rotation. Isn't it amazing the range of motion that we have just in our neck? If everybody just takes a minute, just flex your chin all the way down, just feel that go all the way down, and then feel your head go all the way back. Okay? Look how far you can move that. It's really quite amazing. Tip your head side to side and just feel how far you can actually move your neck. Turn your head side, look over your shoulder to side, and feel how much range of motion you have in your neck. It's really fascinating because there's not only this connection or this movement, but there are actually joints between these segments above and below that, according to two researchers that are biomechanics specialists, we're actually looking at the brain's ability and the body's ability to move. When we look at these abilities to move, what we see is, according to the biomechanists White and Punjabi, in the neck, the angle of those facet joints are at 45 degrees. Okay? That means that in essence they're at this plane, which allows then this movement to occur, and when we actually laterally flex the neck, we actually get more rotation than we do lateral flexion in the cervical spine. Okay? So this, for our students and those who are actually learning more about biomechanics of the neck, when we adjust the neck, we actually make an adjustment across in what we call a coupled adjustment, because in the cervical spine, when we make a correction across, if you are pushing into lateral flexion, you're including rotation. So the spinous process goes opposite of the lateral flexion. Okay? Whereas in the lumbar spine, it goes the same way, which is really fascinating when we look more at adjusting specifically. Okay? So